How a glass of water nearly killed an old person. A true story. Every senior should hear. Let me ask you something. Have you ever taken a sip of water and it went down the wrong pipe? You cough, maybe laugh a little, wave your hand to say, "I'm okay," and move on with your day. It happens to all of us. A little moment, a funny cough, no big deal. But what if I told you there are people who don't cough, who take a sip, the water goes the wrong way, and they never even feel it? No choking, no warning signs, just silence. I used to laugh those moments off myself. A little cough, a whoops, and a sip of tea to wash it down. Never once did I think it could be dangerous. But after I heard what happened to Mrs. Evelyn, I started watching how I drink water. I noticed how I sometimes tilt my head back, how fast I sip when I'm thirsty, how I never really thought about how I swallow. And now, I always pause, just for a second, because I'd rather look silly sipping slow than end up in the hospital, and no one knows why. And then, days later, they're in the hospital, struggling to breathe. Today, I want to tell you a story about a woman in her 80s. Sharp mind, steady hands, a warm laugh. She wasn't sickly. She wasn't fragile. In fact, she had just come home from a church potluck a few days before. She had a little cough, nothing wild, no fever, no chills. Her daughter thought it was just a dry winter throat, maybe a little post-nasal drip. The family doctor said it was fine, just a seasonal cough, and prescribed an over-the-counter expectorant. But by the next morning, she couldn't get out of bed. Her chest hurt. She couldn't catch her breath. And the look in her daughter's eyes as they wheeled her into the ER. That wasn't just worry. That was fear. Later, the daughter told me, "I should have pushed harder. I should have known something was wrong." But how could she? Her mother didn't seem that sick. And like most of us, she didn't want to overreact. That's the tricky thing about aging. Sometimes, what seems like just a cough isn't just a cough. Now, this story doesn't end there. Thank goodness. But what happened next opened my eyes, and theirs, to a condition that affects millions of older adults. And yet, so few people talk about it. It's not heart disease. It's not cancer. It's not even something you'd see in a lab report right away. It's what we call silent aspiration. And it all starts with a single sip of water. And what we discovered in that hospital room that morning changed everything we thought we knew about coughing, choking, and pneumonia in older adults. Let me take you through it. Part 1. A cough that wasn't just a cough. She came into the ER just before 7 a.m. Her daughter was holding her hand, eyes red from a sleepless night. The woman, let's call her Mrs. Evelyn, was in her early 80s. She had silver white hair, soft hands, and the kind of presence that told you she'd raised kids, grandkids, probably helped raise half the neighborhood too. But that morning, she could barely speak. Her breaths were shallow. The ER that morning was quiet, in that heavy way hospitals get right before the morning rush. You could hear the beeping monitors, the low hum of fluorescent lights. The nurses moved gently, like they didn't want to wake the day too quickly. Her daughter gripped her hand tight, not saying much, but you could see it in her face. Please let this just be something simple. The minutes felt like hours. You could see the nurses moving, machines humming. But for her daughter, time stood still. She kept whispering, "You're okay, Mom. You're okay." But deep down, she wasn't sure anymore. Her skin looked pale, almost gray, and every time she moved, she winced, clutching her right side. Within the first hour, they had done blood work, a chest X-ray, a CT scan, and an EKG. Her oxygen levels were dipping. Her white blood cell count was up. The scan showed inflammation and something else. Fluid. In the right lung. Not just a little, enough to be a serious problem, enough to keep her from breathing fully. The diagnosis was clear. Pneumonia. But the cause? That's where the mystery began. Got the attempt to drain the lung. A pulmonologist was called in. They attempted to extract the fluid from her lung using a needle and syringe, a process called thoracentesis. But something strange happened. The fluid wouldn't come out. The doctor pulled back the plunger. Nothing. Tried again. Just a thick drop. One single, slow-moving bead of yellowish liquid. Too thick to drain. Too viscous to sample properly. It made no sense. She hadn't aspirated food. She hadn't thrown up. She hadn't had a recent cold or flu. There was no obvious infection source until they looked not at her lungs, but at her throat. Part 2. The test that changed everything. They ordered a video fluoroscopic swallow study, basically a moving X-ray that shows how food and liquid travel down your throat in real time. Mrs. Evelyn was given 3 things: a cracker to chew, a spoonful of thick pudding-like liquid, and a small cup of water mixed with contrast dye. The cracker? Perfect. The pudding? Smooth. But the water? That's where everything changed. As she took a sip, calmly, without hesitation, the screen showed the liquid moving past her tongue, past her esophagus, and then a thin stream of it slipped silently into her windpipe. No cough, no choke, no reaction. Just a quiet detour into the wrong tube. I've seen that test dozens of times, but watching her sip that water and seeing it go the wrong way, with no cough, no flinch, that still hit me in the gut. She looked at the screen, confused. "Is that, going into my lungs?" she asked. The doctor nodded. And for the first time that morning, she looked scared. Not because she felt pain, but because she felt nothing. That moment changed everything. This wasn't a lung issue. This was a swallowing problem, one that had been quietly, invisibly, endangering her life for who knows how long. It's called silent aspiration. It happens when food or liquid enters the airway, and the person doesn't even notice. Why? Because in older adults, especially after 70 or 75, the reflexes that protect your airway, the ones that make you cough or gag, begin to dull. For some people, they disappear altogether. Part 3. Why silent aspiration happens more than we realize. As we age, several things change in the body, and the muscles that control swallowing are no exception. Here's what often happens. The epiglottis, a small flap that covers the windpipe when we swallow, becomes slower to close. The throat muscles weaken. And sometimes, due to medication or conditions like Parkinson's, stroke, or dementia, the signals just don't fire like they used to. So when water, which is light, fast-moving, and thin, is swallowed too quickly or without good coordination, it slips. And if the body doesn't react, it goes straight into the lungs. Not all at once, not a flood, just slowly, silently, over time. And that's exactly what had happened to Mrs. Evelyn. A little water here and there, enough to cause infection, enough to cause pain, enough to nearly kill her. It's like a leaky faucet dripping into the wrong pipe. You don't see the damage at first, but day after day, the water collects. And one day, the floor caves in. I've seen this happen before. One man, mid-70s, had Parkinson's. He loved tomato soup, ate it every night. One winter, he got pneumonia 3 times in 2 months. Nobody knew why, until a swallow test showed he'd been silently aspirating his soup for weeks. He never coughed once. Part 4. How to prevent it and protect ourselves. After the test, the doctors didn't just treat her pneumonia. They gave her and her daughter a new routine to follow. What they recommended: always tilt the chin down when drinking. This simple change helps direct liquids toward the esophagus and away from the windpipe. Use a straw. It encourages a natural downward head position. Drink slower. Sip, don't gulp. Use thicker liquids if necessary, like water with a little thickening powder. Watch for signs: repeated coughing after meals, wet-sounding voice, watery eyes while eating, sudden fever with no known cause. The daughter later told me she never once choked, never once coughed when drinking. If the doctors hadn't caught it, I would have thought it was just old age taking her away. But it wasn't. It was preventable. Just by understanding what silent aspiration is and knowing what to look for. Some folks also work with speech therapists who specialize in swallowing. Yes, they exist. They might teach simple exercises like holding your breath and swallowing hard, practicing dry swallows, saying ka-ka-ka or e to strengthen the throat muscles. One gentleman I knew called it throat yoga. He said it felt silly at first, but it kept him out of the ER. Maybe next time you drink water, try using a straw, or sit up just a little straighter. Doesn't take much, but it could save you from the kind of hospital visit no one wants. Part 5. Closing thoughts from one elder to another. If you're listening to this and you're over 65, or you care for someone who is, I want you to take this story to heart. We don't have to be scared of water. We just have to be smarter about it. Every time we sit down with a glass of water, we can take a second to remember. Sit up straight, tuck the chin slightly, sip slow, listen to our bodies. You might think it's a small thing, but I promise you, the small things matter the most at our age. We don't trip over mountains, we trip over pebbles. Let's make sure a simple glass of water doesn't become the pebble that trips us. I used to think those little habits, posture, sipping slow, using a straw, were just old people things. But now I realize they're survival skills. They're signs that we've lived long enough to know better. So when I see a friend tilt their chin down before a sip, I don't laugh. I nod, because I know they're doing it right. If you found today's story helpful, please consider sharing it with a friend, a caregiver, or even a grandchild. And if you've ever experienced anything similar, maybe you or a loved one had pneumonia and you never figured out why, I'd love to hear your story. You can email me or leave a comment below if you're watching this on YouTube. Thanks for letting me share this with you. If you're here, listening all the way through, I know you care. And that gives me hope that we're all still learning, still looking out for each other.